I did a video many years ago called Botox Personal Trainer. And since that's probably lost in the dawn of history, I thought I would do a podcast on that theme. And I have jokingly called myself a Botox personal trainer. Hopefully that's not an offense to those who are personal trainers out there. But the reason I do that is I really want you to understand my philosophy about Botox. A lot of times people don't like Botox because they think it's fake, it's poison, it's dangerous, it'll make you look frozen, it doesn't last. And what I try to emphasize to my patients is that it's the single most powerful healing agent that I have in terms of your skin quality. And it is really meant for long-term improvements. So patients that are my patients, not those that have gone elsewhere that have done Botox for years and not really gotten anywhere, but my patients after a year to year and a half, they can come in once a year, twice a year oftentimes, still look good. I've seen a lot of people that I haven't seen in 2 years since the COVID pandemic, and they still look amazing. And they still have some wrinkles there, but they look so much better than the day I met them. So what happens is the more Botox you do, the less you need. It starts to clean up the collagen, the pores, the texture, the tone, sometimes discolorations, even acne scars, linear scars. It can do a lot of things to make the skin repair its own damage. Where when you elevate, you can see some wrinkles, your brows, you can see some wrinkles, or when you frown, but in a rested pose, all those knots and things are all cleaned up. So you look so much better. And that's the goal of Botox. It's not a 3-month fix. It's not something that you have to do every 3 months for the rest of your life. The goal is to be as consistent as possible so that you don't need to go as often. Well, that's very similar in many respects to going to the gym. So if you're overweight, trying to lose weight, you need to get fit. And once you become fit, even though it's great to go to the gym, it's not as important in terms of weight loss, etc. And now, of course, some people argue, okay, well, you can't lose weight going to the gym. You need to have a good diet. This is only an analogy. I'm not trying to make this too sophisticated. But the reason I call myself a Botox personal trainer is I guide you on how often to do the Botox. So I'll say, let's do every 3 months. If I look and I go, man, you're looking really, really good. We've gotten some good distance on this. Why don't we go to every 4 months? And then I may say, man, you're looking so good. Let's go to 6 months. And then maybe at 6 months, say, you know what? I think we're going too long a stretch. We've got to tighten it up. Let's go to 4 months. You know what? You need a little bit more in the forehead. It's not looking as good as I would like. Oh, you know what? This area is peaking up a little bit. Let's bring this back down and balance it out. So a large part of Botox is not just wasting your money. It's not about going every 3 months for the rest of your life. It's about getting your skin clean. How does it do that? Well, that's a whole discussion that's pretty involved, but I'll try to make it simple and short here. One is when the area is not moving repetitively, the fragmented collagen starts to heal itself. And that's a big reason why Botox is so powerful in terms of facial healing. So that is really the upshot of all of this, is that it just starts to heal the skin. How does it heal pores and texture tone? There's something at the smooth level, muscle level there. It creates on microcirculation changes. I have seen even skin discoloration sometimes improve, scars, lesions. They've done studies where they've done split scar studies after a thyroid incision, that one side done with placebo, salt water, the other side done with Botox. And 6 months later, the side with Botox looks incredible. So it's just incredible healing. And that's really what Botox does. And if you're in the hands of a really good Botox personal trainer, that someone can train you and you get the efficacy that's there, you can get results that you've never seen, even though you've been doing Botox for a decade, somewhere else that is.